All right. Hi, everyone. Hi. First of all, thank you all for coming. Um, Today, we are here to talk about the topic, are you sitting too much? Uh, we'll find out. So in this presentation, we're going to talk about what is sitting too much. We all have to sit during the day for various activities, but what is too much and why we are talking about sitting? How can sitting impact our health short-term basis and long-term basis? And the most important part today we're going to talk about is what are the practical things you can do? We cannot avoid sitting, right? But what are the things that you can do so that you don't feel the impact of the worst things that it can do to our body, all right? So next slide, please. All right. So before we get started, I want to introduce myself and why I am here to speak about this topic. So my name is Dr. Nisha Jain. I've been practicing physical therapy since 2006, so almost 2 decades. I am a board certified physical therapist. I have done my specialization in geriatric care. Uh, I am also a yoga expert. I've learned yoga throughout my life, growing up in school, but I did a formal 200 hours yoga teaching course. So I'm allowed to teach yoga, and I'm also a Reiki master. Why I did this course is not so I teach yoga or do Reiki to my clients, but I believe in holistic care. So if I have a client who's coming to me for back pain or knee pain, I don't believe in just looking at the knee or just looking at the back, because there are some associated problems which can cause certain ailments. So we have to treat you as a whole and not as a body part. So I believe a lot in physical therapy and wellness coaching. I also am on social media where my only intention is to promote health, good health, and why it's important to move, and that's why we are here. 2 decades of working has led me to found BeFit Cloud. BeFit Cloud is my baby. It's my practice, and it's a concierge physical therapy and wellness practice. Why is it different from other practices? Because it provides in-home physical therapy, which means we come to you instead of you going to a clinic or hospital setting, wherever you might need that. Why? Because one gives you an individualized treatment. You're not waiting in the clinics in line. You're getting the personalized one-on-one session with a doctor of physical therapy. And which is why instead of long weeks of treatment session, one-on-one therapy may help you get the right guidance. So now that's fine. So why we chose about sitting today and not other topic, right? Because this is all research based. This is not my own made up numbers. Research shows that an average American spends 10 to 12 hours per day of sitting, which means we spend a lot of time sitting than sleeping. We are sitting more than we are sleeping. And that sitting comes in various forms. It is like we're sitting in a presentation right now, going for a movie, dinner time. And we'll come to other, like next slide, where we spend a lot of time sitting. But this is a fact that sitting has become a part of a modern lifestyle, unfortunately. And sitting is now known to be new health crisis. And this is not just for a particular age group. This is from younger age to older adults. So that's why this topic is so important to understand how we can improve our lifestyle. Now, this is what I was talking about. Where do we sit most? Number 4, we know a lot of people spend a lot of time on toilet these days, checking mails or whatever. I don't want to go into the details, but the sitting in the office chair, driving, couch, for kids in the classroom, like this has just become our regular lifestyle. This is sometimes unavoidable. We have to sit. I, being a physical therapy and doing mobile physical therapy, I spend a lot of time driving. I vouch for movement. I vouch for like getting up and do things. But sometimes it's unavoidable for me. I'm stuck in traffic. I drive 20 minutes from one client to other client. And I have personally felt the impact of sitting. And I'm an expert in this field. I know what I should be doing, but it does affect your body still, even though living a healthy lifestyle. So let's see how our body responds to prolonged hours of sitting. We'll talk about the short-term effects that we just may feel in few hours of prolonged sitting. Number one, stiffness. If you're sitting for prolonged periods, what happens? The muscles that are actively working when you're sitting, they get shortened, they get tightened because they're constantly working. For example, you guys are all sitting right now. So sitting needs work, right? Your hip muscles are working to have you sit properly, your lower back, your hamstring, everything is working so you can sit and not fall over. So that's when the muscles are in a shortened position. When they continuously work over time, they get tight, and that leads to pain. That's how back pain starts. That's how hamstring tightness starts. So that's the musculoskeletal effect that it does on our body. Muscle weakness. This word, if you guys read here, gluteal amnesia. We all know what amnesia is, like forgetting things, right? Gluteal is our big hip muscles, the butt muscles, which are known as extensors of our body. What does that mean? It helps us to stand straight. It helps us to push off our leg when we walk. Now, when we are sitting, these muscles are inactive because the front muscles are working, the back is inactive. So what happens? Over time, these muscles are starting to forget how to work, right? So this is just an example of one muscle, but muscles are gradually leading to not knowing how to work, and that's how weakness starts. Poor posture. It's very hard, we all know, to sit up straight and comfortable and tall posture, chest up, things like that. But after 10 minutes of sitting, it's hard to maintain that posture. Even I cannot. I know many people cannot because it's very difficult to sit upright. So what happens? To get comfortable, we slouch in the chair, or our shoulders go forward, or our head goes forward. And especially if that sitting is when you are either watching TV or you're working on a desk, you're so involved into that activity that thinking about posture is like way behind your head. You're not even worrying about how am I sitting. So with time, these changes become so, it's hard to reverse those changes because one day is fine, 2 days fine, but if you're doing that over and over, this is going to make changes in your body. And then reduce circulation, right? You guys all know if you fly, you know that you should get up and walk in the aisle or pump your legs so that your legs don't get swollen. And why that happens? Because circulation gradually slows down if you're not moving. Now, those were the short-term effects, which happens with few hours of sitting in a short term, in few weeks or months. But when all these changes accumulates over the time, what happens? These are the long-term changes that happens to our body. Sitting is, it was an old saying, sitting is known as the new smoking. And you know why? Because smoking, we all know smoking is not good for health because of its effect. So sitting is so bad. I don't want to use strong words, but sitting is so injurious for our health that it has been compared in research with smoking. So sitting increases heart disease, 90% higher risk of type 2 diabetes. And this is all again linked to the chain reaction because circulation is decreasing, the metabolic rate in your body is decreasing. All that inactivity is increasing the risk of disease. And it could be high blood pressure, diabetes, but these, as per research, are shown that it affects your body. Metabolic syndrome, like we just spoke, higher risk of obesity, high blood pressure, cholesterol level, because again, activity is reduced, body is not moving, so you are just spending a lot of time sitting, and then it's a chain reaction, one thing leading to the other. Chronic pain. Now, we just spoke about how muscles get stiff and weak. This causes imbalance in our body because strong muscles are not strong. Muscles that should be flexible are not flexible. So the imbalances over time is going to start giving you pain. And pain is a reaction that the body is trying to give you a signal. I always tell my clients, it's whenever you are starting to hurt or you get some ache, the body is trying to tell you something, that some changes are happening, do something for me, right? So take that as a sign that you need to pay attention to your body. And then, like we just spoke, premature mortality. So sitting more than 8 hours without activity carries similar risk of death as smoking. That's a very big statement, right? Again, not made up by me. This is just all research based. And the idea is just that it's bad for health because of the impacts it causes, right? So now let's get into the fun part. We know sitting is bad and things like that. So how do we know if we are stiff, if we are weak? Now, when you go to a specialist, be a physical therapist or anybody who specializes in this field, whenever you go, the first session is always an evaluation. They want to check how strong you are, how weak you are, what's your range of motion. So that what gives us an idea about how's your mobility and how's your strength. So these are some simple assessments that can be done. It doesn't cover everything, but it just shows from top to bottom how stiff you are, right? So if we sit, the first one is the neck rotation. If we are just sitting and we turn and look over our shoulder, are you able to go all the way and look over your shoulder and something that's behind you on one side and then the other side? Now you want to see, do you have a full range of motion? Are you able to go all the way? And when you are able to do it, that would be great, right? If we can go around. I mean, no, we don't want that. That is hypermobility. We don't want that either. But and when you're doing it, do you feel you're restricted on one side more than the other? When you're doing it, do you feel any kind of achiness, any stiffness? So those are the signs you want to see. If you don't feel anything, that's amazing. That means your neck is not stiff. I mean, I wouldn't say it's not stiff. We are just checking very briefly in one range. We have to do few other range of motion to assess, but it's just giving you a hint that is it stiff or not. If it's not, that's great. If it is, you need to pay attention. Then you have to check your posture. Are you sitting with your shoulders rounded? A lot of us, as we age, especially in women, we start to get a hump in our neck. And that's all because how the muscles in the front are getting stiff and we are losing strength in the back. Toe touch. Now, like I already said, I drive a lot, so my hamstrings are super tight. I cannot, well, I did good today. I stretched a little bit, but are you able to bend down and touch your toes? So that gives us a little bit idea about how flexible our hamstrings are. And same thing, you may be able to do it, but you want to see, is that hurting my back? Is it feeling like it's really a lot of pull? Like those sensations are not normal. And that's why you want to start paying attention to that. Asian squats. Now, why this squat? Because this gives a lot of idea about how flexible our lower back and hip is. I'll demonstrate. I hope I can do it. So basically, you're sitting here, right? And many times I've seen clients with tight hamstrings. What happens? Just to maintain this position is hard. They want to have a support, or the heels will come off because my calf is tight, right? So that's another test just to give us an idea of your flexibility. Cross-leg sitting. I didn't bring a mat, but basically, again, that will give us an idea of how your hip mobility is. Fun fact there, when I started my own practice, it's going to be a year. So I used to drive a lot. And I started because right leg is what you use for, pedaling and driving. My hip started getting very, very stiff. And I could not, when you see in the picture, that's me. My knee was not touching in the bottom just because I started developing a lot of tightness. And usually, when I realize this, I knew if I take care of it, I can reverse it. So now I will do it to prove myself. I can sit, but I was not able to. This hip used to be like that. And I could push it and bring it down, but it used to hurt a lot. And it was all because of the tightness, right? So the point I'm trying to make here is if you start feeling something, you should take care of it and you can reverse the changes. up to a point. I'm not claiming that everything can be reversed. That's why you probably want to go see somebody who specializes in this area, and they can tell you, but do it before it gets too late. The next one is the wings. By the way, those pictures are from the Antelope Canyon when we went, and then that's where like they asked, it was such a quick tour. They're like, go here, go here, go here. And we waited for this trip for so long, but this picture is where they show when the light falls, the wings come up, right? So that's why I chose that picture. That tells us about the shoulder mobility. Are your arms able to go all the way up and go back, right? You got pretty good mobility there. So normally, if what I would ask is stand against the wall and then see if your hands touch all the way back. Now, if you see, in my case, this is super easy. When I go here, I have a little bit, I feel in my shoulder. I have some rotator cuff issues starting to happen. Because I feel I do a lot of weight training, so I have to be careful about that. But it has improved since I realized something is starting to happen. I started taking care of it, and I have almost a full range. And last one, the slight cutoff, but it's a spinal mobility. So when you're sitting, like we did for the neck, how far back can I go? On side to side. And I have to say, normally we move in this plane, right? We go forward and back, or we go sideways. Very rarely we twist in our day-to-day motion. Try to notice that when you go back home and tomorrow, how much we go here, or if we have to get something, we turn our body. Very rarely, especially as we age, we do less rotations. And that's where normally the stiffness starts developing. Right? So these are the quick mobility self-assessment. Now I want to talk about the solutions. I promise you guys will walk out today with some practical strategies that you can adapt right away when you walk out of this room. So small things, what can you do? You all know this answer. Try to move a little bit more throughout the day, right? We all know, do we do it? Sometimes, maybe yes, no, right? So first of all, what is too much sitting, right? There's a slide that is going to come in the back, but I cannot wait for that slide until the end. What is your best posture? We just spoke. It's hard to sit up straight. It's hard to, it's easy to slouch after a few minutes. So there is nothing like best posture, because we cannot maintain that best posture for all day long. What is best posture is your next posture, right? That's my favorite saying. I'm going to quote it. Your next posture is your best posture. If you're sitting for 1 hour and you're sitting trying to be up straight, I promise, I guarantee it's not going to happen that you're going to maintain a best posture for 1 hour. Plus, we already learned about the impacts of sitting, right? Even though you have the best posture and you sit for like everything great, your shoulders are back, your feet are lined up and things like that, the negative impacts that we earlier spoke about sitting, low circulation, tightness, weakness, everything we spoke, that's going to still affect, right? So your next posture, I would say, if you're somewhere and you don't know how long I should sit, keep a timer for yourself, 30 minutes. 30 minutes you sitting down. Just take a break for 2 minutes. I'm not asking you to then stand up for 5 minutes, 10 minutes. Even if you can just get up by your chair, or if you have a desk, walk around your desk. If you're doing anything, toilet sitting, don't sit. 30 minutes is way too long to sit on the toilet. That brings a whole lot of new problems. But just keep a timer for yourself. If you're somewhere like busy in work and you don't know, you cannot keep track of time, put a timer on phone or put a timer on your desk and get up every 30 minutes. Or 40, the max. Don't go more than that. Incorporate standing. If you have phone calls, if you have meetings, stand up. If you cannot invest in a standing desk, that's okay. Just stand up and take a call, or walk during your call, or whatever, whichever scenario you are in and that fits your activity, just try to do that. But we are all smart enough to try to figure out where can you add that sit or standing. Walk more, right? Um, Park your car far away or try to take stairs if you can. Just try to get little bit of movement during your day, which will work on building your muscles, your balance, your strength, your mobility, like multiple benefits of just getting up and moving. That comes my favorite quote. Next posture is the best posture. All right. So continuously changing your position and your posture throughout your day is going to help you prevent stiffness, and it's going to bring your natural movement back, right? Our body is made up to move. Our joints are made up to move and not stay stiff. Why kids are more flexible and we lose our mobility as we age? There's a reason, because we are not using our body. It was meant to be. So just keep moving. Basically, that's the idea. So we're doing good so far? Awesome. So let's talk about some simple stretches and exercises that you guys can do. Again, this is not a medical advice. So I don't know each and every one's of your condition and your mobility. So please consult your, healthcare expert and do that. But these are something simple exercises that you can do on day-to-day basis. So first one, we did our neck mobility test, right? So simple neck turns, side to side. Just turn your head. Now, if you feel the first couple of repetitions, if you are not moving, maybe stiff. So start with whatever comfortable range you have, right? You can only go this much, only go this much. Don't push and try to go over and hurt yourself. Start slow. But if your movement is restricted because of the stiffness, you will notice that after 2 or 3 repetitions, because the neck is starting to, the muscles are starting to loosen up, you can go further out, right? But don't do anything with pain. Pain is a signal or a sign that your body is trying to tell you something, so do not ignore. Seated cat and cow, right? So what this is basically you're sitting here, you roll up, and then you extend. You go down, and you go all the way back. So I'll show you from the side so you know how the spine looks, okay? So right here, what I'm trying to do is I'm trying to create a hump in my back. So what it does is it's bending, it's flexing my spine, and then I'm trying to extend and go as far back as you can. This movement is going to feel really good if you spend a lot of time sitting, because we sit like this, use a lot of this muscle. When you extend, it's going to feel like a whole different world because we don't use those muscles, right? And you can always associate this with breathing. You go down, breathe out. You go back up, take a deep breath in through your nose, out through your mouth. Just do 5 to 10 repetitions of this. It's going to feel amazing. And I've tried all of this. So this does really feel good. All right, I'm going to come back to the third one later because, again, that's my favorite. So we'll talk about that later. The next one is hamstring stretch. Remember we said we sit for too long and the hip muscles and the hamstring gets tight. So that's why this exercise. One leg straight, and then it's called scoop. So just think there's a big, there's a pot of gold there. You go down all the way and scoop it as much as you can and come back up, right? So I'm trying to go, my knee is as straight as possible. I'm trying to go all the way down as far as I can, up to my ankle, even lower if you can. Get all that gold, bring it up, put it in your pocket. All right, let's try the other side. All the way down. Scoop. Again, if you're sitting for too long, this is going to feel amazing. All right, so this is hamstring scoop. All right. Seated open book. Now, if you were here for the mobility test, you would see that a lot of these exercises are based on the movements that get stiff when we move. So seated open book, what is that? So when a book is there, we flip the pages, right? The pages go like that. So one hand straight, the other hand here, and then you're gonna one hand is going to stay stationary. The other hand is going to flip the page. Open the book all the way as much as you can and come back. Right? Now, if you're able to, you want to have your eyes follow your hand. All right? So rotate, 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 stretch. Feel that stretch for 2-3 seconds and then come back. Nice. Guys feel good? Yeah? So let's try breathing with this, okay? You're going to open and take a deep breath in. And come forward and breathe out. And try this. Again, we don't breathe that much. Like we do very short, deep breaths. So breathe in through your nose and breathe out through your mouth. Smell the roses and blow the candles. Okay? Open. Smell the roses and blow the candles. All right? So that's open book. These are simple things we can do day-to-day basis, even when you are in a position where you cannot get up. Now, next one, chair tucks. It's hard to get this exercise, but once you get it right, it is a very underrated exercise. So what you do is, again, I'm going to show you from a side angle. So what I'm going to do is have my index finger on the bottom of my chin, and then the thumb right in between my collarbones, where you will see there is a little gap. I'm going to bring right there. Now, if your head is forward, like normally when we sit, we go like this, right? So it's not going to be a right angle L. So L is going to be a little bit obtuse angle, like more than 90 degrees, right? So our goal is to bring the neck in. Think you're getting a double chin. So pull, slowly draw your chin backwards. If you're doing it right, you'll feel a little bit stretch behind your head. Hold it, 1, 2, 3, 4, 5, and relax. Again, if you're doing this for the first time, it's not gonna feel like, a lot, but as you do few repetitions, you'll feel you're trying. What this exercise does is starts engaging your deep neck muscles. We kind of work on our shoulders, back, leg, kind of ignore our neck. But neck has really, really important muscles. You want to make sure that you're strengthening them. Many times, headaches that we get, it's not always because of something wrong in your brain or your head. It's because of your neck muscles. The neck tension, shoulder tension can refer the pain to your head. And we just try to work on releasing those tight neck muscles and strengthen your neck, and the pain slowly goes away. All right, so these are simple stretches. We have few more. Oh, number 3, yes, thank you, my favorite one. Yes. That's my favorite. I even wrote that down. Now, why it's my favorite? Chair squats. The reason it's my favorite is because the research says it's one of the best exercise. If you cannot do anything, if you do 10 squats, start with 5. Let's just say if you cannot do 10. If you do 10 squats 3 or 4 times a day, your legs are getting stronger, your metabolism is increasing, your blood circulation is increasing. It covers so many, a big group of muscles, right? That's why it has a lot of more advantages. I'm not going to claim this, but I've read it in an article because of the effects that it does on your metabolic rate. It helps with your sugar control too. But again, I'm not personally seen those effects, so I cannot vouch for that, but I have read it. Okay, so chair squats, what you do is basically you're standing in front of the chair, and you're going to try to just sit, but pretend you're sitting, but you're not sitting, and then get up, right? Now, why to have a chair? Because a lot of people do squats like this, right? What happens? Puts a lot of tension on the knees. And then you start getting knee pains and things like that. Having chair behind is just giving you that external cue of where your hips should be. So when I go, you want to have a proper base of support, so not too wide, not too narrow, right? You want to have a little bit narrower than shoulder width apart, and you can position your hands on your waist, in front, wherever you are comfortable, and just pretend you're sitting on a chair. Just feel your thighs on the base of the chair, you know you're there, and get up. And one last thing is make sure if your knees are weak, many times, I see that a lot in the gym, but I stop myself because I should not interfere with anybody's activities, but what happens is the knees cave in. Really, really bad for the knees. That happens because the hips are weak, and when you're trying to do the squats, every time with any activity, if you're weak in certain areas, the stronger muscles are going to try to kick in and compensate. So you may still feel like I can do the squats, but you are hurting yourself, right? So knees out, toes pointing forward, squat, and come back. All right, I'll go quickly through this exercise. These are a few more stretches. Is one, IYTL. Those are your shoulder exercises. So I, Y, T, and then L. This is also called no money. All right? You have money, I have no money. All right? So again, my body is the middle structure of that letter. I'm going to go I and down, and always do slow and control. You don't want to like quickly go through it. Feel the muscles. Y, thumbs up. So you're doing like a 45-degree angle. You're going to go sideways, T, and no money. All right? Scap squeezes. What that is, again, we go like this. So we want to just do the opposite thing. Squeeze your shoulder blades together. Feel a little bit pinch in between your shoulder blades. Hold and release. That's it. As simple as that. Can be done in sitting, standing, whatever is comfortable for you. Wall angels, just like those wings I showed you in that picture. You come here, make sure your feet are touching the back, your arms are here, especially if you're stiff in that range, right? Up and down. Snow angels, but on the wall. That's why they are called wall angels. Breathing, most important thing. With our lifestyle changes, sometimes, you catch yourself and you take a nice deep breath, like a sigh of relief. It feels so good. Why? Because we forget to take deep breaths or not even normal breaths. We are just like so much on the go, rushing, or we are like stressed inside, like so much going on. We just forget to use our core muscles, our breathing muscles. Breathing also is done by our muscles, right? So you have to get a full, nice, deep breath in and breathe out. Again, like we had that timer for getting up every 30 minutes. 30 minutes is going to be a lot to do breathing exercise, but maybe 2-3 times a day, if you can get that 3 minutes out, do 3 reps of deep breaths, smell the roses, blow the candles, and you're good. And it's going to feel a lot better. And when you do that, you're also indirectly working on your core muscles, which is the abs, the back, and your pelvic floor muscles. Many changes happen in those muscles as we age. So very important. And last one, piriformis stretch. Why is this stretch included in this? Because a lot of people get back pain, younger and older adults. And then there is a big muscle, very, very deep muscle. It's called piriformis. There is a nerve that goes in between through that muscle. I have few PT friends here who would agree. There is a nerve that goes through there, and that nerve is called sciatic nerve. Have you heard about sciatica? Yeah, right? So why sciatica happens? Because that muscle gets so tight and that nerve is getting compressed because that muscle has no room, that nerve has no room to move. And that's how that pain happens, right? It looks like, oh my God, I got an MRI done, I got this done. That pain is not going away. Why? Because the problem is not as complicated as is shown in the MRI. It could be just the habits, right? So one leg on top of the other. We call this a figure 4 stretch. So your one foot is going to be on top of the other knee. If you're able to sit up straight, you do. And then the other knee tries to be as low as possible. And then you just lean forward. Again, if you're doing this right, this stretch feels so good, especially if you spend a lot of time sitting like me, who's driving. You feel a stretch on the leg, on the back, around your lower back, and goes deep in your butt. You hold it and come back. And you know an easy trick? Let's try the other side while we are talking. See, this hip, like I told you, was tight, so I feel more here. The other trick you can do is when you do the stretches, don't hold 1, 2, 3, 4, like your therapist tell you for 30 seconds. Do breathing. You're getting breathing done. You really, as you breathe out, you're relaxing that muscle more so you can get a deeper stretch. So cross, lean forward, couple of times breathe in, breathe out, and go back. Now again, everybody's mobility is different. So listen to your body. You don't want to feel a painful stretch. You always want to have a comfort when you're doing the stretching. When you do exercises, you may want to have a little moderate challenge, but not pain. All right, so those were our exercises. I'm going to go to a little bit of a pep talk again, like we did earlier, so that you guys all go home and remember what we learned and do this. Why? Because these small changes on day-to-day basis is going to make a big impact on your life. And I've been, like I told you, practicing for 2 decades. Why I say this? Because I don't get people better in one sitting. We make small changes in their mobility, in their strength. We learn lifestyle changes, and that causes a big impact on a long term, right? So doing
Excuse me.
changes right now, if it's going to be an investment in your health as you grow older and older, all right? So make
Can,
changes now so you don't suffer when you keep aging. Aging is not preventable. We all are going to age, but you want healthy aging, right? Consistency is a key. Don't exercise for today and then don't do for 1 month. Do a little bit every day. You cannot work out for 1 hour, that's okay. You can take 10 minutes out of 24 hours. Doable, very much doable. We take that time out to check our phones, check our emails, go to the toilet, eat. We can take 10 minutes out for ourselves to just exercise. Your health, your choice, right? So if you want to take control of yourself now, you're going to make a better choice for yourself and live a good lifestyle. And listen to your body. I've said this repetitively throughout the session. Your body always gives you signs. Do not ignore it. Don't ignore the pain. Don't ignore if it's trying to tell you something. You're like, oh, many times you're like, this is nothing. It's going to get better in 2 days. Maybe my muscle is just pulled, or like maybe I slept the wrong way, right? If that pain is not going away, please don't ignore it. There's a lot of help available. Go please ask for help. And earlier you do it, sooner you'll get result. When it's acute, subacute, it's treated better. When it turns into chronic, even for therapists, we don't have a magic wand. It takes a very long time. My favorite slide again. Your next posture is your best posture. This is one thing I want you to take away from today's session. Please keep moving. All right. I'm going to get into question and answers. Yes. It's not for you. I'm just saying, so what I said is that movement is important, right? How much sitting is not bad. Too much sitting is bad, right? So to avoid the worst impacts on your health, try to move every 30 minutes. And that goes to even other positions. If you're standing for 30 to 40 minutes, I would say, because sometimes our work or whatever we are doing doesn't allow you to sit like every 20 or 30 minutes. But of course, if you're having pains and aches and tightness, then I would stay to that 30-minute mark. But if you're cooking and standing, you're hosting a party, 30 minutes, please sit down. Maybe you can find an activity, chopping or something that you can sit down and do it, but change your posture. So if you're sitting 30 minutes, get up, take a walk around, move, and then come back and sit down. It's going to just take 2 minutes. Sorry, I'm looking at you, but I'm not pointing to you. So just neck posture is the best posture, okay? Sounds good? Does that answer your question? Because of HIPAA, I cannot say much, but I'm going to say something. I had a 95-year-old patient, all right? And when we started, And there's somebody who can vouch for that, and that's why I'm saying it. I had a 95-year-old patient. When we started, he was barely able to move, okay? He would walk. He had spinal stenosis. Like I was saying, MRIs will show you big things and things like that. And that's why I'm saying the pictures would show something at 95, right? We started physical therapy, right? He used to walk, forward bend, very hard to pick up his feet, things like that. We came to the point where he would stand straight, he would walk as much as he wanted. Of course, he would get tired. We did weight training at 95, right? I would take ankle weights, put weights on his legs, and we did weight training. Every time I would walk out that room, after an hour of exercise, he would feel better. So he would feel, he would be tired, but not that tired, not tired in that sense that, oh my God, exhausted. He did reverse a lot of changes at 95, all right? So age does its effect, but age is a number. Don't people take granted that I'm 80 and 90 and I cannot move, right? You are here, right? You want to live healthy. Everybody wants to be as independent as possible, right? We all say, I want to keep moving as I get old. Nobody likes to be helped by somebody, and we know that. So just keep moving. Age is a number. Just keep moving. Yes. All right, open book. You can do actually all the exercises that we did in standing as well. You don't have to be seated, but it's a modified position. If you prefer, you're uncomfortable standing up, do it in whatever is comfortable. So basically, you're standing or sitting, one hand forward, one hand here. You're gonna open, think about you're turning a page of a book, and then come back. Always listen to your body. If you feel you can only go this much, go that much. If you feel you can go more, go. Again, my body, your body, third person body is different. Do what you can do. And then when you're doing this, you feel that little rotation in your spine. And if you're able to, follow your eyes with your hand. What that does is adds that neck rotation as well. And you can add breathing to it. Right? Every time, common principle of breathing is whenever you are expanding, you breathe in. When you are contracting or you're becoming smaller, you breathe out, right? So I'm opening here, I breathe in, I close, I breathe out. Same thing we did with cat and cow. We close, we breathe out, we open, we breathe in. Okay? That's a common rule of thumb for breathing exercises. Is there any question on chat? Anything else? That's a whole different topic. But I would say you have to do it safely. As a physical therapist, like, of course, ask your expert, whoever is there. But if you have, I don't know your condition, so hard for me to say if you're allowed to bend or not, how much you're allowed to bend or not, or if you're able to squat or not. So normally, we have learned in school, you never want to bend over, you want to squat down and pick it up. Now, in real life, that scenario doesn't always work because of knee problems, things like that. Many times we advise patients to extend one leg back, whichever is weaker, and then try to bend forward. The last resort is you can use a reacher. There's a device called reacher, and then it's basically like a claw. You hold it in your hand, you can pick it up with that, and you don't have to bend forward. Though it's for conditions where you are not allowed to bend forward, I am an advocate for movement. You want to move as much as possible. You stop moving, you don't use it, you lose it, right? However, everybody's condition is different. For some people who are not allowed to bend or bending over is going to worsen that condition, then there is an alternative option available. Again, that goes on a different level. Sort of, I would cover what I can because it's a very, very vast topic. But again, treatment for lymphatic system is, again, movement, right? Every problem solution, not every, but especially when it's related to physical therapy, the solution is move. You move and you don't. But lymphatic system is a condition such that there could be many changes that are happening in your body that could lead to the swelling of the legs. And even though you're doing movement, there is only limited things that you can do, but there is treatment available to that. But what happens is when you don't move, swelling happens. That's one worse effect of sitting for prolonged periods, which we covered. Circulation decreases, and that leads to lower metabolism or lower circulation, which again, I was talking about blood circulation, but also the lymphatic system slowly starts working less and less, and that can affect swelling in the legs. So movement is the solution, but lymphatic system, I don't want to say a lot in this relation because it's a whole different condition. It can be, lymph nodes can be affected because of various ailments, various diseases. So the treatment for that can be very, very different. And sometimes there is a restriction on how much you can move or how much you can do as well. That's why I'm a little bit cautious about just speaking it in general to everybody. But movement is basically an answer to a lot of problems. Strengthening is the key. Stretching is not always an answer, right? That's why we spoke about imbalances, right? A lot of time the problem happens because the muscles are tight, muscles are weak. Now, it could also be because the muscles are, like talking about hypermobility, it could be your ligaments are very, very lax, right? So you have to be very cautious in how much you do the stretching. And there is a normal range of motion for every joint or every range, like shoulder only goes up to 180 degrees, right? Maybe I would take if 185, but if your shoulder goes like you stand without compensation, go too far, I wouldn't want to stretch in all that range because now you are at an increased risk of injury, right? So again, how much I can cover in this much? My biggest answer would be somebody who is hypermobile. You want to do a lot of strengthening and focused strengthening. No, overstretching is not good for anybody. And it's even not good for people who have hypermobility. We all have to stretch within a certain allowed range of motion. And that's why I keep saying like having to consult a specialist. This is a very general, like what we covered are the basic stretches that we can do. My neck, earlier somebody said if the neck goes all the way, right? We don't want it to go all the way. That's a problem. The neck range, normal range is only 90 degrees, only goes over the shoulder. If my neck goes way far back, then it's a problem. And if I'm doing it repetitively, I'm straining my joints and my ligaments. So strengthening and control stretching. If you want also, take my card or a flyer and reach out to me, and I may, if it's allowed, I'll try to send out only those papers. I'm also a lot on social media, so I will be able to, and that's again, no promotion. I just put all stuff there because I believe a lot in wellness and education, and how more people I reach and they make small changes, I'll be more than happy to just bring that knowledge out for free. So feel free to take one and reach out, and I can send it to you. I'll go back to my same answers. Again, these are very generalized exercises. These are for if you are sitting too much, and what are the mobility things that you can do on your day-to-day basis. When you have a certain problem, like we do a thorough assessment of why you are having certain things, and we start with on the assessment, we'll find which muscles are weak and which are strong, and our plan of care will be based on that. So there is something called isometric exercises for the neck, and that's very helpful for people with what you described, right? Crepitus or that cracking could be because of multiple reasons, right? But a very common thing is arthritis, like Rice Krispies, like we know, as we age, joints start crackling and things like that. But again, it would be very generalized statement for me to say that it's normal. It could not be normal because sometimes instability can cause that cracking also. So it's a very vast thing to cover. But again, there are exercises that are particularly designed for the neck pain, for the shoulder immobility, neck immobility, or hypermobility. And I would say you being assessed for that and then have a proper plan of care, and then you can do that by yourself. Thank you all. Thank you so much. First of all, thank you for taking that time to come out. I know 5:30 to 6:30 is a very important time of our day. So I really, really appreciate you guys are already here, and listening to this whole talk says a lot about you guys are very invested in your health. So thank you for coming. And thank you, East Brunswick Library. You were so amazing, and the library and our East Brunswick community, I have been watching, like hosting so many events and available for free to our community. I feel very proud to be an East Brunswick resident and having so many resources available.